Good morning. Myself Dr. Vikas Pandey and I am a holistic physician at Dr. Bharti's Holistic Wellness. Today we are going to discuss about knee pain, that is osteoarthritis knee, with one of my patient got treated here, Mrs. Sarita Sharma, and her husband, his name is Mr. Atul Sharma. You are both welcome.
Thank you.
Thank you.
And so, ma'am, since how long you having this problem, this knee pain? कब से था आपको?
I'm having this problem since 2011.
2011. How did it start to you?
I was not able to get up once in the morning. We were having a puja,
Okay.
so I couldn't get up. So I got a locked knee.
In your left or right knee?
That time left knee,
Hmm.
but right now I'm having problem in my
Right knee.
right knee.
Right knee. So कितनी दूर आप अगर आपसे कोई कहता था कि how long you were able to walk, जैसे कितनी दूर आप चल सकते थे उस टाइम पे?
उस
उस
टाइम
time
पे
पे
अभी
अभी
अभी आप कितना चल सकते
अभी तो
मतलब not
Before
after
the
the
treatment.
treatment, before the treatment.
before the treatment hardly 500 मीटर भी नहीं.
500 मीटर.
मीटर भी नहीं.
क्या क्या प्रॉब्लम you were facing?
लेग्स बहुत हैवी लगती थी मेरे को और चला नहीं जाता था, रुकना पड़ता था या किसी रेज्ड प्लेटफॉर्म पे अपने पैर को रखना पड़ता था और फिर नीचे रख के फिर मैं आगे चल सकती थी.
Okay, one by one.
मतलब कंटिन्यूअस नहीं चल सकती थी मैं, दर्द होती थी मेरी.
And what about your limping? You were
लिम्पिंग काफ़ी ज़्यादा होनी शुरू हो गई थी पिछले 2 साल से, तो काफ़ी ज़्यादा है लिम्पिंग.
okay. So how were you managing this problem?
कुछ भी डिफरेंट ट्रीटमेंट करके इंजेक्शन वगैरह लिए थे, जो पेन के इंजेक्शन है, एक फ्लूइड इंजेक्शन होता है वो भी लिया था, कार्टिलेज का, और ओजोन ट्रीटमेंट एक होता है वो भी लिया.
तो कितना वो आपको हेल्पफुल रहा?
लेफ्ट नी में तो वो इंजेक्शन जो लिया था कार्टिलेज रीजनरेशन के लिए, वो तो उसने काफ़ी हेल्प किया, बट राइट नी में उसका कोई असर नहीं हुआ.
इफेक्ट नहीं आया था.
तो लिम्पिंग बहुत ज़्यादा बढ़ गई राइट नी की तरफ से.
और थोड़ा वो भी हो गया.
हाँ,
ये पैर
लेग जो है वो मेरी
Right
वो
leg
लेग
के
हो गई,
अंदर
राइट लेग.
तो अतुल साहब, मैम को आप देखते थे तो क्या आपको फील होता था? मतलब आप तो आप परफेक्ट हैं, यू ऑल राइट.
Yeah, I mean, what I used to feel is that कि इसके दोनों टांगों में इसको इसी तरह होगा और ये चल नहीं पाएगी और ये bedridden हो जाएगी after a period of time.
ओके
So I was always very anxious and worried about it.
ओके. तो हमारे बारे में मतलब how you
Actually, I was just doing some research, because she was going through all this kind of pain, and doctor has already advised us, to go for a surgery of her knee, which we wanted to avoid as soon as possible. So while I was doing the research on the YouTube, I found Dr. Bharti's
Holistic Wellness.
Holistic Wellness. And then I started watching his videos, 2-3 videos I watched. Then I went to your site, then I looked at your credentials. Then I realized, that you have had patients, which are the President of India,
Yes.
and 2 presidents of India, and then many other luminaries and all. So looking at those kind of credentials, then I read about some people's views also who have gone through this kind of a process. I discussed with her and I asked her, I said, before we go for surgery, would you like to try this out?
Okay.
And she said, I don't mind, if this can avoid.
Of course, if somebody is having pain,
Yes.
would that like to
So
try
past-
something else?
Past 2-3 months I am having so many painkillers that all created all the varicose vein problem and
I have seen that.
indigestion and all.
Okay.
वो बहुत ज़्यादा हो गया था वो
हाँ,
painkillers
because of that painkillers. If you
हाँ,
take those painkillers for longer time,
और मुझे
they can
फिर-
cause you
हाँ,
acidity, all those things.
Then through your site only, we contacted the number which was given, and then the appointment was fixed on the phone with you, and then you guided us as to what exactly is this
So
problem.
online video consultation was
Video
done.
consultation was done,
Okay.
and you guided us, as to what exactly is this problem, why does it happen, and what is the 3 parts of correction, which you are going to be
Yes.
doing, and you will be advising which.
I just brief it to our viewers.
Yeah.
कि this holistic corrective program is contain of deformity correction,
Yeah.
metabolic correction as well as the weight correction too.
Yeah.
So,
Those were the 3 things, so I thought that it is not just exercises only.
yes.
It is a very complete complete kind of a program, which is going to be impacting your metabolism plus your weight reduction, and also the exercises, to increase the gap
Yes.
between the knees, so that you will have a greater comfort while walking.
Yes.
So we found this treatment to be a very holistic. It's just not the name,
Yes.
but it's a very comprehensive one. So we thought that before we go for surgery, let's attempt.
So
once.
you were here for a 12 days
12 days
Yeah.
program
and
and
you have taken
two
the
sessions.
treatment
We
for
have
2
taken
days.
2 sessions
In a day.
every day.
Yes.
And
2 hours
that is-
morning, 2 hours evening.
Yeah. And that is basically, that is the fastest approach of learning how to go through this kind of a process and all those things. And that's why we found it comfortable also, because coming from Bombay and coming and staying here in Delhi is expensive.
Yes.
So if some things can be expedited, it is better. I've heard that many other patients have come. They come
They are coming
regularly.
from other states also.
They come from other states also, and they come regularly. And
Yes.
we met somebody from Punjab,
Hmm.
who was here.
We are
They
getting
are
the
people.
patient from outside also.
Yeah, sure.
But the thing is कि I just wanted to know one more thing कि how simple this thing are to learn.
These are very simple to learn. मतलब आप साथ साथ
क्योंकि लोगों को लगता है ना
हाँ.
ये बहुत डिफिकल्ट होगा, इट्स वेरी डिफिकल्ट टू लर्न. तो आप बताइए कि हाउ डिफिकल्ट इज.
You see, I don't think it is difficult to
Yes.
learn it. It is different.
Yes, it's a different
It
technique
is
is
a different
different.
technique. So these techniques are not normally taught in any of the yoga institutes and stuff like that. But once you have, with the help of the
Therapist.
therapist, who are there, they simultaneously keep training you also as to how to tie the different tools, which are there, which are primarily in the form of straps and
And
knots,
belts.
etc. belts. And now that we are going back, we are going with the confidence, that, and with the determination, that we have to carry on with this, because this is a lifestyle
Yes,
kind of a
lifestyle.
management which we have to do. So we are quite hopeful that once we complete the 3-month cycle of doing this twice a day, we should be able to.
Yes, we will repeat
we
your
will-
X-ray also once again.
Yeah.
And after that, we'll take X-ray, and then
Yes.
based
We'll
on
come
your
to
advice, we
And
will.
after 12 days, कितना आपको how much improve I have received
See,
after this treatment?
12 days मतलब 20 to 40% के बीच में इम्प्रूवमेंट मुझे लगता है.
किस किस चीज में आपको इम्प्रूवमेंट अगर जैसे काउंट करना हो?
जैसे लाइटनेस इन द लेग्स, जो पहले मेरी लेग्स बहुत हैवी होती थी,
Stiffness होती थी.
मेरा मन नहीं करता था चलने का. तो अभी ये है कि मेरी लेग्स मुझे लाइट लगती हैं काफ़ी, और उतना पेन नहीं है नीज में,
Okay.
और कंफर्ट है वॉक करने में.
Okay.
हालांकि डिस्टेंस में अभी ज़्यादा नहीं चल सकती हूँ, लेकिन मैं जितना भी चल रही हूँ उसमें मेरे को कंफर्ट लग रहा है.
Okay.
लिम्पिंग काफ़ी कम हो गई है.
बेटर हो गई पहले
हाँ.
से. ठीक
और
है.
जो लेग बो है वो तो अभी टाइम
वो तो
लगेगा, तो
it's gradual
2-3
थोड़ा
process.
सा
महीने
भी straightness
थोड़ा
नजर
सा
आती है.
फील हो रहा है मेरे को, बट
कि स्ट्रेट हो
सामने
रही है.
I can sense it,
हाँ.
because I
Yes,
see
yes.
it from a distance.
Yes. So would like to suggest this treatment to other person who have been suffering from this kind of
हाँ जी,
problem.
You see,
definitely.
yes, I think what is most important is that first of all you should have the conviction that it is going to do something
Mm.
good for you.
Yes.
And since it is non-invasive and there is no surgery which is
Correct.
required for this, it is just a lifestyle disorder. And if you are very determined about it, and you have the patience, to carry on with this kind of a treatment, with the guidance of the doctors and the therapist out here, I can pretty much be reasonably sure that you may not require surgery,
Surgery.
and you will be able to walk perfectly.
Yes.
Thank you, Sarita ma'am and Atul sir, for giving
Thank you,
valuable
Dr.
review
Bharti.
Thank
on
you.
this
Thank you for
treatment.
all your help, and thank you for all the people out here, सारे therapists or
Yes, yes, yes.
every
You know,
person.
that's one thing which I must
हाँ.
acknowledge, that
Everybody
all the,
is so
all the
cooperative.
therapists and the other support staff, which you have, reception, the person who's offering tea every day, even to the attendant who's been coming with the patient and all, it's very heartwarming, because normally, people are not having so much of emotions and all. People are very sensitive to the needs of the patients, and they're very, very caring. So I must say that the staff has been very good.
Thank you, ma'am. Thank you. And we will take after one review after once your X-ray get it done after 3 months. And again, I would like to thank you for giving such a wonderful review on this treatment, ma'am.
Thank you
Thank
so
you,
much. Thank you, Dr.
Welcome,
Bharti.
ma'am.